For labels? I can show you how to do it on the computer real fast too. Like 15 minutes. So you adjust settings. Body position always like this. Alternating. Advanced it. And then I'm just gonna copy and paste this. And does now. And then say it is, so I can pop my head in, it says that on there for total volume as well. So I'm going to, but this way you can actually see without opening it up. Yeah, and the med, so you can, the brain view does the same thing, but.
Scale on the bed working?
My name is Jeremy Buck. I'm a nurse at Temple University Hospital. Typically this floor was a urology ortho floor. We took patients that were usually voluntary. They came in, they got a knee replacement, hip replacement, surgeries. So then they told us that we would start to be getting COVID patients, and it pretty much turned our unit completely upside down. Most of the nurses on this floor have never dealt with critical patients, high flow, BiPAPs, patients that come in that can decline super quickly. So it was a big change as far as that goes. The pandemic kind of flipped our unit upside down and we typically would hold 27 patients on a very full, busy day. Now they have had to add rooms. We're up to 31 patients at max. We have a permanent dialysis room on our floor, which we didn't have before. It's just made things almost, you could say, chaos. Army was coming. It was really awesome, to say the least. We always been asking for help. We've been saying we need more people, we need help, and then they notified us that the reserves were coming. All of us were like, wow, this is really cool. It's been a huge help as far as, relief on patient load, being able for their experience to come in and help us as nurses. Some of these reserves have never worked in a hospital, but just the fact that they've been able to help with the patients, bring their experience in with us, it's been a huge relief. The Army has been here. They've been super receptive. They've been extremely helpful. Any questions they have for us, they will ask us, and any questions that we have for them, they've been absolutely great with being able to answer those. Our staff has been awesome. They've been able to help us as far as taking heavy loads on patients. They've been able to jump in with no hesitation. Any questions that they have had, they've reached out to us. We've integrated a very cohesive team. The second they showed up to our floor, they were super receptive. They took patients. Obviously, they don't know our hospital system. They don't know how we run, how we operate, but they jumped in. We've worked as a team together. We've been able to help each other. They've helped us. We've helped them. Any patients that show up, they've helped us pull them over. They've helped get them settled. We had a couple of patients that were, having some issues, and they were the first ones in there saying, what do you need? What help do you need? So it's been a huge help, huge relief to have them here. That there is the reserves there in a situation where there's a pandemic, epidemic, things that we really need help. And when I found out they were coming, it was like almost a fresh breath of air. Very scary situation. It's been a scary time, but we are here. We're working together. The nurses are here fighting for you, and the Army is here fighting for you. We're gonna work together to try to tackle the situation the best we can. I mean, it is overall super scary, but we got to hit it head on. That's all we can do.